sleep isn't just like to feel good, right? It's essential for brain development. How much sleep do children and teens need? I'm Dr. Lewis. I'm a psychiatrist, child psychiatrist, integrative psychiatrist, and let's look at this very important question because we live in a world where sleep is not valued and prioritized, and sleep in childhood and teen years might be particularly important. So according to all the big organizations that give out statements about sleep, like the National Sleep Foundation, American Academy of Sleep Medicine, the amount of sleep we need varies by age, right? So babies, infants, they need 12 to 15 hours of sleep. School-aged children, 6 to 13, 9 to 11 hours. And then teens, both organizations have the same recommendation, 8 to 10 hours of sleep. And I'm really curious what percentage of teens in the country, in New York City, actually get 8 to 10 hours of sleep. So sleep isn't just like to feel good, right? It's essential for brain development. And in early stages of life, it's brain's like way of organizing and reshuffling everything, and it's essential for like cognitive development, psychosocial development, and it helps with learning, it helps with memory. So when a baby sleeps after learning a new behavior or task, something, they will retain that knowledge better, right? There's also research like that in adults. And sleep is also essential for mental health, right? So there's a very clear data, lots of research from different populations, basically showing that when kids don't sleep enough in elementary school, they will suffer more mental health issues later in life, right? So that's like early, right? Like if you miss out on sleep in 2nd grade, 3rd grade, 4th grade, right? You will have more mental health issues later. Also, your performance on neurobehavioral, neurocognitive tests may be lower, right? So that's, that's like even from like a stretch of time. And what happens if there's persistent, long-term sleep issue? Right? That can affect intellectual development. That can affect all kinds of things, right? So behavioral problems, also cognitive functions like attention. It predisposes to anxiety and depression, right? It gets in the way of good school performance, and it increases behavioral problems, right? So there's so much concern about child mental health, and I wonder if we're, as a society, not giving enough weight to the importance of sleep, because that would require us as a society supporting kids and supporting teens, and that means changing school times, right? So they fit with when kids want to sleep and how much they need to sleep, right? We have some longitudinal studies that track kids over time that clearly show that sleep deprivation in childhood increases anxiety and depression in adulthood. Right? So with all this high intensity, lots of homework, right? So I made a different video about these pressure cooker schools, high achieving schools. Are we setting up our kids for mental health issues later in life? So chronic sleep deprivation is linked to depression, right? And there might be changes in how the serotonin system develops. Serotonin and wakefulness, the circadian rhythm, all of that is interconnected, right? So if you throw that off in development, in childhood, it potentially changes things in how the brain works, how it's structured. It also changes the microbiome, it changes metabolism. Like, we don't fully even understand the impact of lifelong chronic sleep deprivation. Kind of we're in this big experiment with what's happening right now, at least in many of these high-achieving schools. So overall, totally clear and plenty of data that sleep is important, that kids need enough sleep. Yes, we need more research on, we don't fully understand, a lot of things about sleep. So we need more research to really understand, like, the details of sleep, of like deep sleep and slow wave sleep, and, how it plays into executive function, growth, all of that. But the kind of the big picture is, it's important, right? Let's let our kids sleep, right? And let's, as a society, encourage our children to sleep, right? So, I'm a big proponent for sleep training of in early life, babies, right? Like, let's teach kids to sleep well from the start. It's not always easy. It's particularly difficult for mom, right? So this is where dads, also partners, can help out. Because I think I cried just as much when sleep training my kids as they did, right? So it's hard, but it's so important. So being really diligent about like having very, very clear sleep schedule for our children. When your child is young, right, like you actually have control, right? It gets harder as they get older, but when they're very little, we can teach kids there's a bedtime and there's a wake up time. And sleep is very important, right? And we stick to the routine. And we sleep in the same place, ideally. And we value sleep and prioritize sleep and, build a life so that it, in general, respects sleep times, right? And wake up times. So that kids can really grow up with the sense of like orderly sleep schedule. Like, let's instill it as much as we can, right? Of course, life demands all kinds of things, but when possible, right? We'll do our best. And then with middle school and high school, it's often the pressure of school, homework, activities, social stuff, phone, screens, right? It gets much more difficult to navigate with kids, and very important, right? So protect sleep, right? And as a society also, like, or, choose schools that have later start times, especially for teens, right? Teens have a delayed sleep shift, right, phase. So they want to go to bed later and wake up later, right? So a school that starts at 7, even 8, way too early, right? Ideally, it would start more like 10, right? But that's not convenient for a lot of other things. So it's not so easy to do, but as much as we can, let's move in that direction. Definitely not in the other direction, so that kids have a chance to sleep more. And let's also be mindful to not like overschedule and overpack, right? So it's not so easy. And sometimes also, like, you may need an expert. You may need a psychiatrist or someone to guide potential like medication use. Even with melatonin, it's good to speak to an expert to get guidance on what to do when sleep issues are more severe. Overall, sleep well, and let's pay attention to this issue. Thank you for watching, and see you next time.